Welcome to Perspectives from the Field panel. Today's presenters are Matthew Dieppe, Rowan Willis Powell, and Rebecca Kim. Matthew is coming to us as a program manager from California Youth Empowerment Network. Rowan is project coordinator at C4 Innovations, and Rebecca Kim is a peer workforce manager at Anami, California.
Everybody, Matthew here. I use he, him pronouns. I'm tuning in from Koreatown, Los Angeles. I'm the program manager at the California Youth Empowerment Network, CAYEN, which is a youth-led program of Mental Health America, California. I'm excited to share about my experiences in this role, as well as previous roles in youth work across the state of California specifically.
Hi, everyone. My name is Rowan. I use she, they pronouns. I'm coming to you from Baltimore, Maryland. I'm super excited to talk about my work at C4 Innovations in our newly formed Center for Youth Wellbeing team, and to also talk about my previous work experiences of working as a peer support specialist in a myriad of settings. And I'll pass it over to Rebecca.
Thank you. So my name's Rebecca Kim. I'm the peer workforce manager at NAMI, California, and currently I am overseeing the Medi-Cal peer support specialist certification training programs here. Who are peer support workers? Peer support workers are people who have been successful in the recovery process, who help others experiencing similar situations. Through shared understanding, respect, and mutual empowerment, peer support workers help people become and stay engaged in their recovery process and reduce the likelihood of relapse. Peer support services can effectively extend the reach of treatment beyond the clinical setting into the everyday environment of those seeking a successful, sustained recovery process. This definition is from SAMHSA, the Substance Abuse and Mental Health Services Administration. And it's important to note here that a peer support worker is someone who has lived experience and uses that experience to empower others to go through the recovery process. And so what does a peer? So peers support a range of activities and interactions between people who share similar experiences of being diagnosed with mental health conditions, substance use disorders, or both. It is the peer support specialist's role to provide resources to the client to support them in their recovery process, whether that's offering resources for different types of treatment or helping the client to be in a stable environment. So we're going to do a little deeper dive into the role of a peer support specialist. What is the role of a peer support specialist? So some of the things that you see here are listed: advocating for people in recovery, sharing resources and building skills, building community and relationships, leading recovery groups, and mentoring and setting goals. So these are just some of the things that may be in the role of a peer support or a peer specialist, sorry. And some of these roles may extend to providing services and or training, supervising other peer workers, developing resources, administering programs or agencies, and educating the public and policymakers. As a peer support specialist, your duty may be to support your clients in such services, but it will most likely depend on your employer in what capacity you are able to support your clients. You may need to reach out to other community-based organizations to gather additional resources, such as low-income housing and assisted living, and you may also need to help your client with applying for low-income or no-income healthcare benefits and other social benefits, such as food stamps. And so we're going to go over some definitions. So two terms here: the recovery model and the medical model. The recovery model is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. In the medical model, the concept that mental and emotional problems are, I have a hard time pronouncing this word, but analogous, I hope that's right, to biological problems. That is, they have detectable, specific, physiological causes, such as an abnormal gene or damaged cell, and are amenable to cure or improvement by specific treatment. The recovery model uses a more holistic approach that is person-centered, and person-centered language is often used to demonstrate respect for each individual's basic humanity. It's a compassionate and stigma-free approach that supports the client's healing, progress, and goals. And there are 4 dimensions that support recovery, and they are health, housing, purpose, and community. And we'll go over that a bit more in the next slide. The medical model approach is often used by psychiatrists, and medication is oftentimes used as treatment, and a diagnosis can potentially become the primary focus of the client or patient's identity oftentimes. And so we're going to go a bit more into detail with the recovery model. The recovery model, again, is the foundation of recovery in the mental health field that comes from the hope and the belief that things can be overcome. And again, there are 4 major dimensions that support recovery, which you see listed here as health, home, purpose, and community. The recovery model is a holistic model, and it prioritizes the individual and their strengths and abilities, whereas the medical model may characterize an individual by their diagnosis. The recovery model is important because it's one of the core competencies taught in the Medi-Cal Peer Support Specialist certification training. So let's dive a bit more into the recovery model. And so I'm going to read, or I'm going to kind of explain a bit more about the 4 major dimensions. So for health, to manage or overcome diseases or symptoms and making informed health choices that support physical and emotional well-being. Home is having a stable and safe place to live. Purpose, having independence, income, and resources to participate in society. And community, having relationships and a social network that provides support, love, hope, and friendship. Recovery looks different for everyone, and it's not something that happens suddenly. It requires patience and guidance. And so we're going to look into the key to recovery. So the key to recovery is giving an informed choice, being held accountable, and creating a recovery environment. The recovery model allows the individual to take an active role in their own treatment plan by giving them the opportunity of making an informed choice. When a choice is given to the individual, it gives them the chance to discover themselves in combination with being held accountable for the choices that they make. They are able to reflect on the decisions they made and grow. As peer support specialists, we must empower our clients by providing tools and resources to help their recovery journey. And we can do that by encouraging the use of community resources and helping them build their own recovery toolbox, something that works specifically for them. So think back to the 4 major dimensions that support recovery. I talked a bit about housing, health, purpose, and community. In order to achieve recovery, these 4 dimensions may be something that could contribute to a successful recovery process. As a peer support specialist, be prepared to provide support and resources for your client to prevent them from reinstitutionalization, but also be prepared for the potential to relapse. Some examples of resources that you could provide are housing resources, volunteer or employment opportunities, and maybe even help them go back to school to finish their education. In addition, a peer support specialist could also help their client reintegrate back into society by encouraging them to attend support group meetings. So why is recovery important? Recovery and improved health and well-being are the goals of behavioral health care for individuals with a mental and/or substance use disorder. Because a mental health and/or substance use disorder crisis often results from environmental challenges and events such as trauma, job loss, financial or relationship troubles, or other interpersonal stressors, addressing these real-life issues is crucial to sustaining recovery. Remember, recovery looks different for everyone, and everyone will go through a different recovery process and may require different types of support and services. It's important to remember that recovery emerges from hope. Recovery is person-driven. Recovery occurs via many pathways. Recovery is holistic. Recovery is supported by peers and allies. Recovery is supported through relationships and social networks. Recovery is culturally based and influenced. Recovery is supported by addressing trauma. Recovery involves individual, family, and community strength and responsibility. And recovery is based on respect. So given that information, is the peer support specialist position for you? And that's a question that I will leave with you.
Like I said in my introduction, I've worked as a peer support specialist, and currently I'm working in a more of a kind of national administrative role. In my role, I work for an organization that works on a myriad of projects, ranging from ones that are very research and data collection oriented, and ones that are more about implementing models and training young adults to work as near-age peers. In my role, I really heavily focus on ensuring that youth voice is at the center of everything we do, and that every kind of aspect is looked through a lived experience lens. In my past, I've worked as a peer support specialist, ranging from providing one-on-one peer support to doing group peer support to doing some crisis peer support as well with young adults and adults. Me as a person, I got engaged last year to my partner, Livy. She's a therapist, and we live in Baltimore City with our orange tabby cat, who may decide to join us at some point. Finn loves being witnessed by large groups of people, so that is a thing that might happen. And I'll pass it off to Matthew or Rebecca.
Matthew, if you could share with us next, tell us about you and your work.
Everybody, yeah, I'm gonna take it back from the beginning. So when I graduated high school, went to college, I wasn't really sure. I didn't know about the whole peer movement yet. This was back in like 2014. And I just knew that things had to change. Like the kind of services that were available for me as a young person were really culturally incompetent. There was not this level of respect and empowerment. And oftentimes it was talked about as some form of punishment rather than seen as a support system. And so that kind of anger with like not feeling like we had great resources for my community. And I grew up in a predominantly Asian American community. My family is Vietnamese. I just wanted to see better. And so I started a student-led club in college called Cypher. And we used hip hop dance as an expressive outlet while collaborating with different mental health professionals on campus to help facilitate discussions about mental health. And so it was really this like, we literally led these workshops in parking lots because it was the biggest free space available. And we got like 60 college students out on like Friday nights to come out and dance and talk about mental health. And it was really peer-based discussion-led environment, just making sure that we had someone in the field, in the behavioral health field, different roles to help be there to kind of give us different frameworks to guide the discussions. And that was my first sort of introduction into like a peer-led environment, and really inspired me to care about the peer movement. And that's where I learned about that language from that work. But from there, I ended up developing youth programming in the domestic violence prevention space, leading youth advocacy projects in Los Angeles with Center for the Pacific Asian Family. Worked there for about 2 years, and that led me to my current role at the California Youth Empowerment Network, CAYEN. And we mentor youth across the state to help identify what are those behavioral health challenges that exist in your local communities? What is the change you want to see, and what are those barriers so we can connect them with decision makers who can help make that a reality? And for many of these youth, they want to become peer certified, and a lot of them don't know about the opportunities to do so. So it's really encouraging to see the peer movement really thriving right now. And we provide workforce training and education opportunities for you to learn about the peer specialist certification and how to become involved in this movement. But yeah, I'll share more about that later, but I'll go ahead and pass it to Rebecca.
Thank you. So me and my work. So I am the peer workforce manager here at NAMI California currently. And I oversee some of the programs here that for the Medi-Cal Peer Support Specialist Certification Training Program. And so part of my role here is to do some outreach and recruitment for these positions. And then we also do training here. Part of my role is also to train individuals in some of these sessions. So it's a great way for me to interact with participants, but also the outreach and recruitment portion where, we're trying to reach out to different communities and also people who need this training for the work that they already do or for the work that they are wanting to do. And so that's what I do here at NAMI.
Thank you all for sharing. You all are doing great work and seeing a need and fulfilling it in the ways that speak to those that need the support. Next question. How did you end up working in the behavioral health field? And I think Matthew spoke to a little of that already. But Matthew, if you could tell us a little more about how you ended up working in the field, and I'll ask the same of you, Rebecca and Rowan.
Sure. Growing up, being a gay Vietnamese American, growing up in a Vietnamese household with like strong Christian values, there was a lot of like shame and hiding and like self-hate around my identity. And then seeing this kind of reinforced just through homophobia in my school environment. I grew up with a lot of like dealing with a lot of depression, anxiety, self-harming behaviors. And because of the shame and the hiding, I wasn't getting the support that I needed. But in a school setting, when you see a student like talking back to teachers or not showing up, they really saw me as this punk that needed to get punished, when in reality, I really needed support at the time. And on top of that, I was using substances as a way to cope, and all this hiding eventually escalated. And my school used 5150 as a way to threaten me to like comply. And it wasn't being used in a way of like, Matt, what's going on? How can we help you? And I think a lot of it is just the need for this conversation to evolve. I think a lack of training on the school admin side. But the traumatizing experience of going through that is really what propelled me into the field, wanting to just see better and do better, and being able to uplift what would have been helpful for me, what I've seen in my peers' experiences. And that's why I ended up studying psychology, and that's what led me into this space. And it's really been great, like since, the last 10 years, really seeing the needle get pushed in a positive direction.
So I think I have an odd situation. My mother is a social worker. So I tell folks that I actually kind of grew up in the behavioral health field. I grew up with this hyper awareness of what mental health was, what mental health services were available. And so when I started to kind of struggle with my own mental health issues due to a lot of traumatic experiences, I was kind of like thrust into receiving services very, very quickly, and was able to, I think, avoid other traumatic experiences by being hospitalized through my mother's assistance. It all kind of came to a head when I went to college for a year. My mental health just got progressively worse. So I came home. I was lucky enough to kind of have those connections with my mother that she, when I came home, said, Rowan, you either have to get a job or you have to become a volunteer doing something, and introduced me to the concept of peer support, and was very privileged to get a job as a youth peer support specialist with our local Youth Move chapter. And it kind of shoved me down this career path that I never even knew existed previously, and really allowed me to hone in onto the things that I was incredibly passionate about, making sure that other young people that didn't want to be hospitalized didn't have to, even if they didn't have a really strong advocate supporting them. Making sure that young folks knew how to kind of navigate the system without having to go to the hospital to get the treatment options they wanted, and really kind of diving into this work that I think if I hadn't had this opportunity would have just been a weird passion of mine. So yeah, a lot of it comes back to the fact that I was able to grow up with a really supportive advocate, and with this early access to a lot of knowledge about the behavioral health field.
So for me, kind of like Matthew, growing up in a Korean family, a strong Christian belief household, there was not a lot of support within my family around mental health, and that was always a struggle because my family didn't believe in mental health. They didn't. It's kind of like a topic that's like, oh, okay, there's something wrong with you, and we'll just leave it at that. And so I didn't really think about my own mental health or mental health at all until like I went to college and got my first job, and went through depression and a bunch of other things. I started working as a resident assistant in college, and I realized working with a lot of first year students that a lot of the time people drop out of schools, people have a hard time like in their classes, because they are going through a bunch of mental health issues that come up for them. And so that's when I kind of really started to think about working in the behavioral health field. And I majored in public health overall because that's kind of, I knew I wanted to go into that field. And so after I graduated college, I had the opportunity to volunteer my time with AmeriCorps, and I was working for City Year in elementary schools. And this was during COVID. And so I just realized that, you know, a lot of teachers were quitting, the principal had quit because it was just so hard, right? Students were suffering. They were 2 years at home or studying from home, and all of a sudden they have to come back, and you know their education is not where it's supposed to be, and so it was very challenging. And so after City Year, I was doing a lot of job searching, and the coordinator position at NAMI California kind of fell into my lap as an opportunity for me. And so I knew I wanted to work in behavioral health or health in general. And so I took a chance at it, and I really like working here. Now I'm the peer workforce manager, and I'm helping other people go into this field and also train them. And it's been such a pleasure working with people who are just trying to, who are going through recovery by them or for themselves, but also trying to help others who are trying to seek recovery.
When we talk about peers, what is the most important thing to consider in differentiating between children, youth, and adults?
There's a couple of things. And I think one of the things that you'll hear from any youth peer advocate or youth voice advocate is that children and youth are not little adults. I feel like that's kind of a common misconception, that they're just smaller versions of us. And that's not really true. When we think about working with young people, you have to consider the fact that they're at different developmental stages. A 12-year-old is wildly different than a 16-year-old or a 19-year-old, just thinking about like how our brains develop. A 12-year-old is going to be so hyper focused on gaining independence for the first time, and a 19-year-old has already had a taste of that independence. It's also really important to remember that families play such a huge role in young people's lives. So when you're providing peer support to a young person, you're also kind of providing peer support to the family, even if it's not directly. The family will frequently be some type of aspect of that young person's lives. I think another kind of quick element to keep in mind is that as adults, even if we're close in age to young folks, something that commonly comes up is this, I call it a fear response. We hear young people talking about experiences that even if we had them, whether it be suicidality or substance use, it can make us feel worried and scared and concerned. And that can really come between providing authentic peer support. And that's also a thing that clinicians have to think about too. But to provide really authentic peer support, you have to kind of find a way to acknowledge that fear and then put it on a little shelf and keep going on and doing your role. So that's something that's really crucial. And we know that that near age peer model works really well. I think everyone can identify that we get more out of conversations when we know the person we're talking to has a similar life experience to us. And a lot of that comes out of them being a similar age. So having near age peers available is such a crucial thing. And so the more that we can kind of lean into doing that, the better.
What have been some challenges to working as a peer advocate, community engagement specialist? Can you speak to that for us?
Yeah, absolutely. I think one that a lot of us can relate to, if not everyone, is burnout. Being able to figure out those boundaries between, there's so much work out there to be done. When we look at the ratios of behavioral health providers to people who need services, it can get really overwhelming. And being able to just identify, like, in this role, in the time that I have in this current job, what is manageable to get done, and working with our team to really define that and establish that. And there's a question later about boundaries and workplace, but that's been really important to make this work sustainable, especially doing it in a virtual environment where some of us are probably just at home, isolated all day in a computer screen. It can be really tough. So finding ways to get support and not neglect, like self-neglect. But another thing I want to highlight sometimes is seeing the lack of adult allyship. Sometimes in spaces, a lot of the adults in the space maybe just haven't had the opportunity to be trained on how to work with youth leaders and really opening up the appropriate space to center their lived experiences. We say this over and over, but youth are the experts of their experiences. And if we're trying to meet their needs, we need to center them in the planning, implementation, and evaluation. And so sometimes a challenge is we need to even open up that space that hasn't even existed yet. And finally, creating sustainable efforts, or making it really clear when we are doing work in a community, what is the scope of this? Is this a one-time workshop? Is this a project that's going to be here for a year? But what we find is frustrating sometimes is a lot of the funding to do this kind of community engagement work lasts for a short amount of time, maybe like a year or 2 years. But then we end up bringing this programming that is really life-changing for a lot of the youth in the community, and they want to see that stay there. So trying to identify ways to make this work very sustainable and part of the community ecosystem rather than just kind of a blip in the universe. But something that's been really helpful for doing that is making sure that we are capturing data and really defining what data points we want to capture in the beginning to measure success, so that for something that may be a short-term project, we can have the opportunity to expand it, scale it, and make it sustained. But yeah, those are some of the challenges that I've personally observed in the work.
And I invite Matthew and Rebecca to answer this one. How can departments and organizations benefit by incorporating youth voice into their programming?
How can departments and organizations benefit by incorporating youth? Youth are super important. They are the future, right? Like Matthew said, I think it's really important that their experience is their own, and we have really no say over their overall experience. I think it's important because a lot of the times you'll see in the clinical setting or even in peer support, we don't have a lot of youth in the field. And I think that that's a problem, just because, you know, as generations go on, there's a lot of things that change and develop over time. And we need people, or we need individuals and youth that are, I don't want to say relatable, but I guess technically it's relatable. Yeah, uh, because I mean, everyone has their own experiences, but it's so important to have youth voices in these conversations because, you know, they're living it, they're doing it, they know what's happening. And so they'll be able to support others in that sense. But I also think it's important because we do need people in this job force, right? A lot of the times people are so interested in going into psychology or psychiatry when in college, but they need to know that there are other job opportunities available out there for individuals, especially for individuals who have gone through the recovery process and are looking to support others through the recovery process. And I think that it's super important because peer support specialists is completely different from the clinical setting, right? There's that lived experience portion where people who have gone through substance use disorder or mental health illness, and they're living their day-to-day lives, they have experiences that they're able to share with other people and support that in a sense where clinicians may not be able to. And so I think that's super important. But also giving youth a chance to look into a completely different and relatively new field now that this has gotten so big. So I think it's super important to have youth in this kind of work.
Yeah, just add some quick bullet points, like echoes to everything Rebecca just said. I think how can we incorporate them? Make it clear what your expectations and their roles are. Work with youth to define those roles. Hiring youth for full-time jobs, providing youth with appropriate mentorship, giving them stipends for spaces that they're being included in, consulting with youth as experts and paying them at a rate comparable to consultants in the field. But just finding different touch points for where you can include youth, whether they're short term, which is totally fine. Youth are busy, and sometimes if it's just a one-time meeting they can help with and be compensated for, great. And if it's a long-term project, even better. And making sure that you're ready to provide the appropriate mentorship and support for that more long-term engagement with youth, especially.
And for our last question, Rowan and Matthew, how do you establish boundaries between your professional and personal life?
I think it's something that you just learn to do over time. I know that I've definitely gotten better at it at age. When I first started and I was 19, I had no boundaries for my professional and personal life. And I think it's just something that you kind of learn how to do. Having mentors to kind of set those examples for you is so crucial. And also, it depends on the organizational culture. Some organizations aren't great at kind of setting that expectation that you have work-life boundaries. I feel really lucky to work at C4 and kind of have both in my team and in the organization an expectation that I am taking care of myself. If that means that I'm going to a CrossFit class at like 4 p.m., do that. That means I'm doing yoga, but just making sure that it's an aspect of my work so I can be good at my job. is really helpful.
Yeah, Rowan, I love what you said about like having mentors and thinking about the culture at the workplace. That's been so big for me. I felt burnt out, and my boss asked me one day, like, how are you doing? And I was like, honestly, I'm not good. And she's like, okay, what's up? Like, what's happening? And I let her know, like, you know, I was working such late hours to get projects done. My lunch breaks felt too short. I felt like I want vacation, but I can't take them because there's, you know, it feels like there's too much happening to take a vacation. And she sat down with me and helped me like map out dates I wanted to take off. She helped me like figure out where I can cut off hours and reduce hours in some places. She didn't know I was overworking myself as well, and that was a big part of it too. And so part of that was, okay, like we need to drop these projects, or we need to pause here. We need to bring in more teammates. And I think that's what the culture should be. If personally, I think if, you know, your boss is letting all of that slide, that can be really harmful to you and just not sustainable for the organization. I really appreciate working at a environment where, you know, they care about my well-being, and that's been really big. It's just communicating about when things are getting tough so we can pull in those support systems and help each other. And also, I don't bring work into my bedroom. I make a separate little corner for work.
And here's all the care information, websites, socials, and newsletter. So follow, subscribe, all the good things. Thank you all.